Okay, so welcome everybody. We're going to go ahead and get started since you all that's on time. I appreciate your time today. Just a little introduction. My name is Christy Smith, and I'm the assembly person for the 38th California Assembly District, which includes the communities of Simi Valley, San Fernando Valley, Santa Clarita, and Acton and Agua Dulce. So assembled with us here today, we have nonprofits from across not only the district, but also with us from LA BizFed Institute, a nonprofit represented doing great work in the county as well. So we're going to facilitate a conversation today about what's happening with the local nonprofit community, what services are being offered to the community during this pandemic, and how people can connect with those services, and then what the community can do to help our local nonprofit. So I welcome each of you. Thank you for your time and participation. And I'd like to make some quick introductions about who is joining us today. We have Scott Irvin, co-founder of Feed SCV. We have Michael Foley, Executive Director of Bridge to Home. We have the Reverend Dr. Vermack, Executive Director of Family Promise of Santa Clarita. We have Krista Warfield, Director of the Domestic Violence Program at the Child and Family Center. Fred Bauermeister, Executive Director of Simi Free Clinic. Marari Galara, Executive Director of the Samaritan Center. Mitchell Vieira, Program Director of the Los Angeles County BizFed. And Brian Gavidia, Government and Community Relations Manager at the Northeast Valley Health Corporation. So welcome to each of you. And we just have a few short questions that we'll run through the roster and have each of you answer, and I'll call you out by name. But let's start with Scott from Feed SCV. Tell us a little bit about the nonprofit you represent, and what resources and services are you providing to the community during the crisis?
Okay, hi everybody, and thank you, Christy, for having us. This is awesome. So we're fairly new on the scene. We basically have three missions to try to make it keep it really quick. One of our missions is education. We give classes on how to cook and open it up to basically everybody. That right now is shut down for the most part, although we are trying to put some stuff on YouTube to kind of, fill that in there. The second mission is what we call intervention. So we've helped feed people, refugees, during things like the sand fire and the tick fire and things like that. Right now, we don't really have the resources to do anything on a citywide basis like the crisis we're having right now. So that's sort of not in play right now. Our biggest program lately has been what we call the Ready to Learn Backpack Program with the Newhall School District. We've been providing as many as 60 kids 300 meals each weekend in a backpack. Right now, that's also been shut down. Initially, it was shut down because of all the panic buying. We couldn't get the single-serving, shelf-stable type of things that we use for the program. And once the schools shut down, they didn't have a way to accommodate our program. The schools have come back to us now and said, okay, they can accommodate us, and we think we can get the necessary stuff that we have. But right now, our biggest issue is that we do not have a space to assemble that and be safe from the standpoint of the virus protection. So right now, that's kind of what we're trying to figure out is where can we find a space? We've rented a space. We have had a space for a year now that we've been using, but it's basically enough to store the food that we buy, and then a couple of people to come in and assemble it once a week into the backpack. So right now we feel that that's not a safe situation. So that's kind of where we are.
Well, thanks for that update, Scott. And for anyone watching at home, all of our local school districts across the entire 38th Assembly District are providing school meals for children who would ordinarily qualify for that breakfast and lunch program. They are drive-through pickups, and that information is available on our website here, Christie Smith Assembly website. You can find where to go to pick up those meals. But to Scott's point, you know, for so many families, they do need those additional food resources. And so for anyone out there that might have a space that Feed SCD would be able to use to help our families with those additional resources not included in a breakfast and lunch program, that would be a great connection. So thanks for that, Scott. And moving on to Michael Foley with Bridge to Home. Michael, how are things going at the shelter right now? And what services are you providing to support folks?
Sure. Thank you very much for this, Christy. We appreciate the opportunity. First, all of the programs for Bridge to Home continue. We always provide navigation, case management, linkages to housing and services. All of those programs continue through an access center. We also provide a 24-hour-a-day, 60-bed shelter. That program continues as well. However, because of tight quarters in the shelter and in order to meet the requirements for COVID, in a 6-day period, we worked with the city to move the shelter lock, stock, and barrel to the Hall Community Center. So now all services that Bridge to Home provides are being provided at the New Hall Community Center, once again, 24 hours a day. So anyone can come and get assistance and help there between 8:30 and 4:30, and then it's the shelter for the remainder of that time. Also, very importantly, on Saturday, we are the lead agency for the Santa Clarita Hotel project. So on Saturday morning, 50 of our most vulnerable neighbors had the opportunity to move into a hotel room. At this moment, we have a list of people who are continuing to come in. We expect by tomorrow night that all 50 of those beds will be filled. So the need is great, and we're continuing to meet that need.
Great. Thank you so much for that update. So again, that was the New Hall Recreation Center. If people need to come in and ask for assistance, that's where you guys are located now.
That's correct. Right behind the train station in New Hall.
Right by the train station. Fantastic. Thank you so much. Reverend Dr. Vermack, what's happening with Family Promise now?
Like Bridge to Home, we don't have a site, so we use congregations where our families sleep overnight. All 14 congregations closed. We tried to rent from 2 of them. They were not willing to do it, afraid of the fallout when their preschools open again, etc. The county dissuaded us from renting churches or even synagogues. And so what we're doing is I had to let go of our 3 staff on unemployment. I'm working full-time. I'm doing case management with former families and new families. And our biggest ally is Bridge to Home, because they get the vouchers. We have to refer our families to them. And just spoke to a family this morning that was able to be housed by Bridge to Home in Chatsworth. And so if they can't help them, if the county can't help them, or LA Family Housing can't, then we put them up in a motel. Mm. And with that, you can't say it's a homeless family. I have to go house friends at a motel.
Right. Wow. Well, thank you so much for trying to keep services going in this really, really challenging time. We appreciate you and certainly appreciate your partnership with Bridge to Home. Moving on to Krista Warfield, Director of Domestic Violence, the Domestic Violence Program at the Child and Family Center. I know Child and Family Center is still offering services. Could you let us know what families would be able to access?
Yes, absolutely. Thank you for having us. We are families, we're trying to keep as many services going as possible. So we know pretty much the only thing that we're not doing right now is our outreach programs due to schools being closed and on-site groups because of social distancing. But we are still providing mental health services, substance abuse services, our intensive programs, the telehealth, which also, because of the pandemic, we've been able to be a lot more flexible than you normally can be for domestic violence services. So we've gotten the approval to do those services through telehealth as well. So we are still providing all the services that we do for safety of clients. We also have a crisis shelter open. And then, of course, just trying to maintain social distancing and supplies in there as well. So we still have groups for clients. We're still getting DCFS referrals. We're safety planning for clients. We have case management. We are assisting actually with a lot of restraining orders lately. People are isolated with their batters, and so they're learning that we're able to do assist with the restraining orders over the telephone, and they can file through fax. We have had, I think this past week, we had 4 in just 1 week alone. So we are still providing all of our services, super important for people to know.
Absolutely. All right, thank you for that. And Fred Bauermeister, Executive Director from Free Clinic of Simi Valley. What's happening at the Free Clinic?
Thank you, Christine, for hosting this as well. I appreciate the opportunity to meet some new folks and share what's going on with all of us. We're functioning, of course, greatly modified. We provide 4 primary services: medical services, marriage and family counseling, legal and dental services. And our dental services were shut down for about a week, and then they came back to just emergencies. So this week it's just on Monday and Wednesday that we're providing services for dental patients. And medical has actually expanded hours a little bit. We've added some more volunteer physicians to be here, and we're basically seeing everyone via telephone. We do have walk-ins, but we've taken precautions to allow for that. So, for example, we've removed most of the furniture from our waiting room, and we have signage on the front door that says, "Wait outside and call us on the phone and tell us here, and then we'll invite you in if we decide that it's safe to bring you into the building after you've been screened." And so basically, we're refilling medications for patients. We have a lot of patients that are diabetic or hypertensive, so we're taking care of those people. And then we're doing screening to ensure that people's questions are answered and they're assured that they're okay, or we're referring them to the appropriate services should we think that they might have COVID-19, which is basically the county or the local hospital here at Venice Health. Our counseling program picked up pretty quickly with a program called Doxy, D-O-X-Y, which is a HIPAA-compliant video platform similar to Zoom. And so we're still seeing our clients via Doxy and a few via telephone. But that service really hasn't been interrupted much. It was a pretty quick transition over to Doxy. It was just getting people up to speed to using it and stuff. So we're looking after our clients. And so I guess, we've pretty much adapted to this environment. I guess we're going to be in it for a while. So we're preparing to be in this environment until at least, I guess, until May 15th, if not longer. So again, that's where we're at. So thank you, Christy.
Yeah, thank you, Fred. And moving on to Marari, Executive Director of Samaritan Center in Simi Valley. What's happening with Samaritan Center?
We are following the best procedures to be compliant with the COVID-19. We are still case management over the phone. We're still doing pantry for our local community members. We are doing lunch and dinner and breakfast as well, meals for our homeless clients. We're advocating for them to get into the motel system with the county, and we currently have placed 30 homeless individuals into the motel provided by the county. So this is just a little hard for us because we are trying to provide services for the most vulnerable population, which is the homeless, and we're in an uphill situation here. So I appreciate this format to be able to communicate the services that we're currently having. Thank you.
Thank you. Yeah, and a little later on, we're going to switch the conversation to how the community can reach out to help all of you. I noticed that we've been joined by Jane Stanton from the North Valley YMCA. Welcome, Jane. We'll get to you shortly. And next up, moving on to Mitchell Vieira from LA BizFed. Mitchell, why don't you tell us what's going on in Los Angeles County with BizFed?
Yeah, absolutely. So thank you again for hosting us today, Assembly Member. We are excited to talk about our program that we're running right now. BizFed is an association of business associations like chambers of commerce, trade groups, industry groups. But we have the BizFed Institute, which is a 501c3 nonprofit that is dedicated to coming up with solutions to big policy issues. But today we're talking about our personal protective equipment, a PPE drive and campaign that we're currently running all over LA County, trying to collect PPE supplies, both medical and non-medical, including N95 masks, gowns, gloves, goggles, face shields, looking at cloth masks, surgical masks, a wide variety of different types of supplies and products, and trying to be able to have our frontline essential workers be better equipped in the work that they're doing every day. So we're working with a wide coalition, all 39 assembly members and senators in LA County, plus the Service Employers International Union, SCIU locals in Los Angeles, and the County of Los Angeles, as well as the Hospital Association of Southern California. So it's a big partnership between a lot of powerful players, and we're really excited to be at the center of it. We're going to be sending out information to our members. I know the assembly members and senators are sending out information to their constituents, and SEIU is doing the same thing. So happy to answer questions and go into a little bit more about how you can get involved, but that's the general idea of what we're working on.
Great. Thank you, Mitchell. Jane, I know things have really changed for you down there in the North Valley with the YMCA. You've really transitioned the work that you're doing and serving the community. Could you share with us a little bit about what's happening at the Y?
Hi, thank you very much, and thank you for your help. So the YMCAs in Los Angeles have been very much impacted with us all being closed and our childcare sites all being closed. And so that has been very difficult for all of us. So we have transitioned to several other things. None of our branches are doing showers, 9 to 2 for the homeless, and that has worked out really well. Many of them are doing grab and go. Many of us are also doing blood drives now. And our blood drive will be working with UCLA Health on May 4th. And we are trying to help the community everywhere we can in the areas that we can. So it's been very special time for families, all of the people that are working together on this conversation as well as us.
Thank you, Jane. I appreciate it. And Brian from Northeast Valley Health Corporation, what's happening with you guys?
Sure. Thank you again for hosting this roundtable, and to your team for their amazing work. Northeast Valley Health Corporation, as you know, is a federally qualified health center which provides primary and preventive healthcare services to the residents of the San Fernando and Santa Clarita Valleys. We're currently operating 4 health centers in our 3 WIC sites in the Santa Clarita Valley, including our Valencia, Santa Clarita Health Center and our Rainbow Dental Health Center, along with our Newhall Health Center. Our health centers are open to patients for essential health services, and we're offering also telephonic and telehealth visits to facilitate healthcare access to our patients, folks with non-essential medical needs that we could work with remotely. We're also currently testing for COVID-19 and providing necessary medications and follow-ups. We have a screening process at our health centers prior to the patients arriving, and once they're at the health center, to help protect our staff, our patients, and the community at whole. We're preparing for an increase of patient visits. So in the coming weeks, we can expect to see emergency rooms, intensive care units, probably at capacity. And we're increasing our role in testing and treatment. So we've built up our reserve for PPE, and we're gonna start implementing drive-through health visits for symptomatic patients using methods like testing them at their car, creating separate rooms so we could safely test these patients, and make other necessary adjustments so they make sure the safety of all our patients and members of our community. I do want to emphasize that we provide health services to anybody that walks through our door, regardless of their ability to pay, regardless of their immigration status. So that's something crucial and important to everybody that's in the call and everybody that's listening. So.
Thank you. Thank you for that information. All right, so we'll track back through the list now, and I would love to give each of you the opportunity to reach out to the community. What can community members do that would help you do your work right now? And starting back at the top of the list, Scott, what could the community do that would help feed SCV right now?
Well, I mentioned it before. If anybody has a space that we could use, we can store the food that we have and transport it to a space, and it literally takes a few hours once a week, and we're fairly flexible right now, in particular, because of our volunteers. A lot of them are, like a lot of us, even though we might be working during the day, our days are a little bit more flexible. So any kind of space that we could have for 2 or 3 people to show up for a few hours to assemble the backpacks, that would be great.
Fantastic. Thanks, Scott. And Michael, how about with Bridge to Home? What could the community do that would help Bridge to Home right now?
Well, let me tell you, Christy, I want you to know first, however, I was very excited to be on this call with you, but now I'm especially excited that I'm on the same call with the legendary Jane Stanton. Jane, hello again. Thank you for all that you do. You're amazing. And so one of the most important things here in Santa Clara Valley is a commitment to meal sharing. Meal sharing has been a part of Bridge to Home since the beginning, and literally every meal at the Bridge to Home shelter has been provided by volunteers. We were very frightened in the beginning. We had a number that were dropping out who weren't able to come, but it's been almost just extraordinary, the rallying. There has not been a meal, maybe 1 or 2 that have been missed. And so there's volunteer opportunities are always there. It's always very important at our shelter. So please go to www.b2home.org and look at the volunteer page, because there are definitely things to do and meals that are needed. But like most nonprofits right now, our biggest concern is funding. We've increased our services well over 100% in the last 16 months. And there's matching dollars that are attached to all of those contracts. And for many of us, Bridge to Home included important events in these last 3 months have had to be canceled. So there's a very important need for donations. I know here at Bridge to Home, we need at least $50,000 between now and June in order to make ends meet. So for folks to, again, go to our website, make a donation, or give us a call, that's the most important thing for us right now, along with ongoing volunteerism.
Right. Michael, give us that website one more time.
www.b2home.org.
Fantastic. Thank you. And Dr. Vermack, what could the community do that would help support the work of Family Promise right now?
In the same boat as everybody else, funds have dried up. If a church is available or a congregation is available to open up their site and not live out of fear, because all the churches are closed. There's like literally nobody on site. If churches can get past the fear factor, that they don't have to come and be there. Open up your site. Let us house families for the next month or 2 or the next weeks that are ahead. Let us deep clean when we're done. Or if somebody is willing to rent a room in their house to a family, that in the end is cheaper than putting families in motels in the long run. We can house them for 14 days in a motel, make sure they don't have a virus, and then house them with the family. So we are looking at alternatives from the community that they would not typically think of. Let me take in a family and rent for a month. We don't have a lot of Airbnb VRBOs in the Valley. That's one of the big problems, but we do have in San Fernando, etc. I just think people need to change their attitude about what space is available and space that is empty. I look at the old senior center in Santa Clarita that's been locked up and boarded for the past 8 months. It's just empty, just sitting there. And that's what we are looking at. Mike approached us about the site, but we simply don't have the funds to take families there. Hotel prices have come down a bit, but as I say, the moment you are housing homeless families, the hotel shut up and say, sorry, you can't house them here. It has to be your friends. So we're just looking for various ways for the community to step up and say, let's make a difference. And then we can do drop-off of meals. You don't have to come in, just like restaurant pickups, drop off the meal, family can sterilize the dish and they will have food to eat, and we can get our volunteer system going. My problem is finding host sites.
Understood. And how should the community reach out to you? Do you have a website or a preferred phone number if people have housing or support to offer?
Yeah, our website is familypromisescv.org and telephone 661-251-2867 or my cell phone.
Wonderful. All right. Thank you for that. Krista from the Domestic Violence Program at Child and Family Center. If the community wanted to support the work of the Child and Family Center, or specifically what's happening with domestic violence efforts right now, what could they do and how should they reach out?
I think for the domestic violence services specifically, I think the biggest thing right now is really letting people know that the resources are available. The hotline is a 24-hour crisis hotline, so that's 661-259-HELP. So people might have to wait for their batters to go to sleep to be able to reach out for services. In addition, of course, funding is always an issue. We could, we do have the crisis shelter open right now. Of course, we have staff still providing services, so just making which is very hard because everybody's struggling with this, but of course, protective, gear, just to keep everyone safe and healthy. Continue to donate. And again, these are all hard things because people are really worried about running out of them themselves. So for a minute, we were concerned about having to shut down the shelter because of, grocery supplies at the store, toilet paper, paper towels, napkins, things like that. So just continuing to donate, and then any type of gloves, disinfectant, spray, things like that. We have on our website at childandfamilycenter.org, we have wish lists. So if people can follow that wish list, because we have some OSHA requirements and stuff like that for the facility. But I think just really knowing that the resources are out there, grocery cards, just little things like that, so we can go out grocery shopping for the shelter and not have to pull funds for other things, of course.
Okay, and where should people go to find a portal if they wanted to help and contribute? How should they contact you?
They should go onto our website, childfamilycenter.org, and they can look up and see what we need. And then, of course, calling even the agency ourselves, and then we can work out picking up or them dropping off or anything like that.
Great. All right. Thank you, Krista. Fred, if the community wants to reach out and help with Free Clinic and See Me, what should they do?
Well, we welcome anybody that wants to bring by the homemade masks because we can give those to our patients that don't have access to them. We actually have a pretty good supply of masks and gloves right now. Direct Relief, which is one of our partners, was very generous in making sure that we had enough N95 masks, and Adventist Health brought over some surgical masks. So we're pretty good for us, and we can share those with the community, but generally speaking, when people are looking for something they can do, making the masks is probably a good safe thing. Unfortunately, even though we're a volunteer-based organization, we reduced to practically eliminating all of our volunteer lay people. So all the high school age volunteers have been excused from the clinic for the past month and a half. So only the core staff is here, the physician, the nurse, and the receptionist. There's 3 people down the hall from me, and they're the ones that are doing all the work. So unfortunately, we can't invite the community in to help right now because of what's been going on. But the thing that I think that we need to look at is what's happening after the COVID virus pandemic subsides, and all of the people that are out of work flood our organizations. And so we're giving a lot of careful thought to that. That's how we're approaching our funders, to say, we appreciate your support, but we need your support in the months ahead, because that's when it's going to hit. Most people are afraid. I'm sure Brian would agree that people are afraid to come to your clinic because they're afraid they're going to come into contact with somebody with the virus and they're going to contract it. I know this has been the case at the hospital, is that their regular patient population has been reduced, and they're prepared for the COVID-19. In our case, we're just maintaining care for our patients, and there haven't been we haven't done any COVID-19 testing here, wouldn't plan to. But when the doors open and everything gets back to whatever normal looks like, we're going to be busier than ever. So that's, where we're at, Christy.
Thank you, Fred. Marari, what are the needs at Samaritan Center right now, and how can the community help?
Yes, the needs would be homemade masks as well, so we can provide our homeless clients a mask to be able to wear it out in the community. We're also seeking gift cards in the value of $5 to $10 so we can continue our dinner site by providing our current clients with a voucher to go get a hot meal. We're also in need of 2 individuals for our shower facilities to reopen. That would be running the showers and maintaining the sanitation. So I know that in our community, we're searching for those 2 individuals. And like everybody else has echoed, it's monetary donations to keep our nonprofit going. So thank you so much for this group, Christy.
Of course, of course. And how would people find you if they'd like to make a contribution? Do you have a website?
Yes, we do. It's going to be www.samcentersb.org. They could always mail it as well. We have a P.O. Box 940 568 Simi Valley, California 93094, or they can reach out to me at 805-630-3949. Thank you.
Thank you so much. And Jane, if people wanted to be supportive of the efforts at the Y, what are you in need of? How can they help?
Yeah, thank you for asking. There's a number of things that we're doing right now, but everybody can help, all the groups that were on here today. One thing that we are doing is we're calling all the seniors to asking how they're doing and if they need help. And that is really heartwarming for them to hear from us and for us to know how we can help them. Funding is absolutely critical to everybody that's talking today. You can go to ymcala.org. Pick the Y that you like to support, or pick the emergency fund. We really need help for all 26 YMCAs. Another way is sign up for the blood drives. There's a lot of blood drives, either through Red Cross connecting with our YMCAs, or as I mentioned, UCLA Health connecting with ours. Also, for those that are feeling that they want a fitness or a workout, go to the ymcala.org. On the rotator, there's 360, the Y360 fitness site, and also Life Fitness site. Join in any of the groups there and continue some level of fitness while we are isolated from each other. Funding is really the critical, and everybody's mentioned that. This is such a very special time for everybody home, everybody here, everybody that's closed. Really, really special time for the first responders. So we're trying to help everybody we can. ymcala.org.
Fantastic. Thank you, Jane. And closing out with Brian, if the community wants to support what's happening with the health centers, what can they do?
Sure. We continue to seek donations for PPE, particularly sanitizers, hand sanitizers, N95 masks, cloth face masks for our patients and non-clinical staff, gowns, goggles, and folks can visit www.nevhc.org. And we have a COVID-19 relief fund, which you won't miss when you visit our website. So we're either accepting the actual donations of PPE or monetary donations online. And additionally, again, I want to emphasize something that Fred mentioned. A lot of folks are scared to come into our health centers, be it because of the fear of the spread of COVID-19 or public charge, what have you. Let's help each other by spreading the word and letting our community know that our resources are available. So our community can continue to pursue them. And thanks again for hosting this.
Thank you, Brian. So I'm going to kick it back over to Mitchell from BizFed, because exactly the intent of the work of the partnership, as he described, with officials from LA County, with our Los Angeles County legislative delegation, and all of the wonderful members and affiliates of the LA business community are pulling together to try to streamline the push out of PPE to our most critical needs. And that, of course, is all the folks on the front line, healthcare workers in our home health settings, in our clinics, where the need is great and the access has not been easy. So Mitchell, why don't you go ahead and detail that for folks and what the community can do to support these efforts?
Yeah, absolutely. So like I said earlier, we have a list of products that we're collecting, PPE, both for medical professionals, so medical grade products, as well as non-medical, cloth masks, certain types of surgical masks that can be used by frontline workers, such as grocery store workers, such as childcare workers, home health care workers. And so that's the process that we're built in right now. The website that we have is bizfedinstitute.org. You can go to bizfedinstitute.org and press the button on the home screen. It will take you to a form to fill out and determine how many of each product you have to give, or if you'd like to give a monetary contribution that we'll use to then purchase and supply more PPE. The form will allow you to put in any quantity that you'd like to donate. So we have some people that are donating 5 N95 masks, and that's great. That's wonderful. And we'll direct them to a donation site, and we'll gather those up and supply them to the County of Los Angeles, who will distribute them through their hospital preparedness program. And then if you have, some people will donate 25 cloth masks, and that will go and be distributed to frontline, essential workers, grocery store workers and the such, through the SCIU, which is one of our partners. So we're working, really hard to match people up, both donors and recipients. We're making a huge announcement tomorrow on a big donation that was received, and some of that is going to even go to help the homeless population. So we have masks for homeless as well. So there's a big announcement that we'll be making tomorrow about that donation and how that's going back to the community. So there's lots of ways to get involved, anything from a small 5 N95 mask to 150 to 200 surgical masks. We're getting all sorts of different sizes. So I'm happy to take them and happy to encourage people to go to bizfedinstitute.org, or you can contact me. My phone number is 949-838-7497.
Right.
Anything else you'd like to add, Assembly Member? I know you've been a big part of this campaign as well. Thank you.
Yeah, no, thank you. We appreciate it, and we appreciate the partnership across LA County and the generosity of spirit and time that folks are pouring into all of this. But I've often said it's one of my favorite things in public service across these communities is that we just have this robust, wonderful, amazing community of nonprofits who stop at nothing to deliver when the community is in need. And I just like to thank each of you, individually, collectively, for the work that you continue to do in these really challenging and trying times. I appreciate you spending some time with us today and letting folks know what is available through your various agencies and groups. We will continue to share this information, but we also want anyone watching, listening to feel free to reach out to us if you saw something here today that you know you need more help with or can contribute to any one of these good folks doing this work out in the community. Please reach out to us here at my office, 661-286-1565. And in the meantime, just thank you all so much for the work you continue to do, and stay in touch. All right. Thank you all very much.
Thank you,
Take
Christy.
care.
Thank you.
Thank you. Bye, everyone.
Thank you.
Bye.
Thank you.